Hello everybody, I'm Dr. Anthony and this is Dr. Casen and DeMaria, and this month we're talking about breast health. So we've been having a lot of people send in questions, so I'd encourage you, if you have questions for our upcoming months, make sure to look for our emails and submit your questions for the health topics we're going to be discussing. And this month we are talking about breast health, and breast health's been something that's been very important to us. We've been working with ladies in our office for many years, and we've done a service in our practice the last decade called breast thermography. So we have a lot of strategies that we've seen that are beneficial when it comes to breast health. So Dr. Casen, one of the questions was, why is breast health so important?
That's really good. So it's really interesting. So in the last 10 years of doing breast thermography, our breast tissue is really truly a reflection of what's going on the inside of our body. And I know, Dr. Anthony, even with doing thermography in our practice, it's interesting because if someone's lymphatic system is compromised, or even their liver health, and a lot of women have a plugged up liver from having kids, that really can show up in the tissues as fibrocystic tissue, or even like tenderness in the breasts, a heavy menstrual flow. Those are common body signals that we see in our practice.
So, this is probably one of the number one things that I see, and we get this question a lot, is what is the difference between a thermography and other types of testing like ultrasound, MRI, or mammogram?
That's probably the most asked question that we get, whether it is through email, social media, or even with our members coming in that they're doing thermography. They will always ask, so Dr. Casen, does this mean I don't have to get a mammogram? And what I love to share, and I know, Dr. Anthony, we have a little picture here just so I can show. So thermography is a measurement of temperature. So if you can see in the tissues here, it shows temperature over time, which is a reflection of function in the body. Now, a mammogram shows structure, something that's already developed into the tissues, which it can take up to 8 to 10 years for something to develop on a mammogram. And lastly, ultrasound, which I absolutely love referring women in conjunction to the thermography for ultrasounds as well, because an ultrasound would show soft tissue. And probably the most common thing that we see with that is fibrous tissue or fibrocystic tissue. So all of them are tools to improve overall health and help with prevention. Not one replaces another, Dr. Anthony. I know that that's really truly the case. Is everything has a purpose and a place. I do know women are looking for more conservative options when it comes to their breast health, which is why I share everyone can benefit from breast thermography. Starting at age 22, a woman can start doing thermography also.
Well, the great thing about thermography, it's really a functional test of breast health. So we're able to see and go over things to help improve breast health with ladies. That's definitely different than an ultrasound, mammogram, or MRI. So the cool thing for us is when we see people do the strategies that we go over with them, that their breast health actually improves. So that's really something cool. And what a lot of people might not realize too, when you couple thermography with something like an ultrasound, your chances of making sure that you have a full comprehensive approach is in the upper 90 percentage points, whereas each breast modality by themselves is lower than that. But when you couple them together, it really is a comprehensive approach. So how about, Dr. Casen, this is a great question. What are symptoms of having unhealthy breast tissue?
That's really good too. So on our questionnaire, which is very comprehensive, some of the questions are, do you have tenderness in your breasts? And this could be around a woman's cycle, but it might be even after breastfeeding and having children that someone might have tenderness in their tissue. Also, dense breast tissue, which is very common. Women might feel this fibrous band, lumps, even swelling in the tissues. That may be a body signal. I would say in the last several years, Dr. Anthony, some of the more serious cases that we've seen, if you have any type of change in the nipple area, like an inverted nipple or a change in breast size, that is very important in regards to, you want to be really familiar with your tissues, because about 17% of breast cancer is silent, meaning it may not show up on a thermography, even a mammogram or an ultrasound. So as chiropractors, we work with the nervous system to help someone's overall body health, but you also want to have a comprehensive team, whether you're here in Westlake or in our Naples, Florida practice. You want to find a chiropractor. You want to find someone to sit down with you to create these preventative strategies, because it truly is not waiting for something to show up or to have discomfort in your breast. You want to really create a protocol, and that's why I love doing thermography, because it is easy, non-invasive, and we really can create a gentle, easy thermography strategy with nutrients.
So why would someone make an appointment?
Well, if you are listening to our video, go back to the beginning, because if you are a female over the age of 22 and you're not breastfeeding and you're not pregnant, you want to do thermography. Also, one other little item that I want to share is if you've had breast surgery, any type of biopsy, mastectomy. I have a lot of women with implants. I have women that have had their implants out. So if you have scar tissue or fibrous areas, that is why you want to do thermography. But you do want to wait 3 months until after any procedure, breastfeeding or having a baby. And the reason why is that changes your normal body temperature also.
That's great. Well, these tips are going to help change your life. So if you're interested in making an appointment, give our office a call, 440-471-4200. Have a great rest of your day.
Bye.